Hello, I'm Dr. Dennis McKenna. I'm joined today by Kevin Zhang. Kevin, it's great to have you here.
Thank you. Thanks for having me.
Yeah, of course. Kevin is our Chief Nursing Officer, and we're going to spend a little time learning about you and your journey to get here in just a couple of minutes, okay?
Yep, sounds good.
All right, today is Thursday, August 31st, bringing you the update from Albany Med. All right, Kevin, as promised, welcome to Albany Med.
Thank you.
I think you've been here now about a month.
5 weeks. Yeah.
5 weeks. All right, very good. As I mentioned, you've been hired as our Chief Nursing Officer. For those who have not had a chance to meet you, why don't you explain a little bit your journey to become a nurse practitioner, and then ultimately into nurse leadership?
Yes, absolutely. So started again as a nurse. Wasn't those folks that always wanted to be a nurse. Not sure, just wanted to really help people when I was younger. Long story short, got into nursing, love it. I think the reason more I want to explain is to how I stay in nursing. And because some of us always to start in something and we could change careers, and just love the aspect of helping patients in the most vulnerable state. I think that's where I see patients are in hospitals and healthcare settings. Later on, went to grad school, became a nurse practitioner. Most of my experience is spent in critical care, cardiothoracic surgery, and such. Really love that kind of provider side of pieces as well. Spend some time understanding there's some life-changing event in our family that I want to have a more system view. So became a consultant as well to get that aspect of healthcare. Went to business school with the same thought process to really understand and help how I can lead better to impact more lives. And here I am today in Albany Med.
Well, we're glad you're here.
Yeah.
And
Thank you.
What would you list as your top 3 priorities as our Chief Nursing Officer?
That's a great question. I think I'll start off with just the key domains that I'll explain to my team, and hopefully nursing as a division as well, is that I see the 3 pieces. Number one, we'll call them a trinity, is the culture, strategy, and operations. And I think right now, just being the last 5 weeks, there are definitely a lot of great things in Albany Med, and nursing has been doing. It's a great foundation, and I think there's definitely also opportunities for us to make it more efficient and or go to a next level, and which I think the entire medical system, health system, it's going. And so I'm sure that nursing obviously had to play an important part of it.
It sure will. It absolutely will. And you came in and joined a very strong team of nursing leadership here, many of whom have been here for their entire career. One in particular that I'd like to talk about is Mary Alice Cullen, of course. Now, Mary Alice has a very special role in your org chart here as our Associate CNO.
Yes.
That's a new role. We haven't had that before, with some particular domains that you want her to focus on as well.
Yeah, absolutely. Thanks for mentioning that. And absolutely, Mary Alice has been a key leader in the nursing organization and Albany Med as a whole. And we're happy and very excited to announce her to be our new Associate CNO and really have oversight of the women and children, at the same time kickstart very exciting pieces of patient experience. And that's a continuum, obviously impactful for all parts of a patient journey. So that will be up and coming. I'm sure there'll be a lot more things we can talk about in the future.
For sure. I mean, Mary Alice has been intimately involved in patient experience, partnering with Dr. Ostroff in the formation of our, for example, a Patient Family Advocacy Council for Pediatrics, our PFAC. She's spoken passionately about the patient experience.
Yes.
I think besides the work that she's going to do in the Children's Hospital and helping with our business and our staffing development in nursing, I think that she'll be a great addition there.
Absolutely, no doubt.
And then I'll also say you did not come here alone. I understand there's 2 in the family that are working here at Albany Med, right?
Yes.
So,
two for the price of one.
Okay.
And my spouse also joined the medical college as assistant professor as well here. So our whole family is here.
So let's give a shout out to her. What's her name?
Efthamia Ileana Mathel.
Okay, very good.
Yep.
Very good. And which of the departments in the college is she going to be working in?
Yes, she will be in the Department of Immunology and Infectious Disease.
Well, welcome to her as well.
IMD.
Welcome to her as well.
Thank you.
Good.
Thank you.
Well, we're pleased to have you here. We'll have you back again, obviously, to sit in this chair and talk more about your vision and nursing.
Perfect.
All right? Let's change gears and let's talk about our involvement in the community. We've talked about this many times here in the past. It's as important for our workforce to be involved in taking care of people in the hospital setting as it is in the community. We partner with Mr. Charles Day. He's our Director of Community Relations, and the Dean over in the college is a fierce advocate of making sure the medical students are in the community as well. Service learning, they're expected to do 40 hours in the community, and they can be involved in a couple different projects. One of them, recently, we've had 90 medical students involved in the Pamela J. Harper Block Party. And what they were doing is they were in the community doing education on tobacco cessation, the importance of wearing helmets, first aid, other areas. I think they also helped serve food to the community. And it was a really well-received thing. And just one example, really, of many where our medical students and our workforce finds a fulfillment in taking care of the community. And that's the type of thing that I know that many nurses like to do as well, whether it be breast cancer walks or being involved in other types of activities in the community.
And if I could comment one thing on that, and then that's why I'm excited to join this organization. It's not just what we do in the hospital, but outside in the community.
Right.
And Albany Med as the health system really going to play a crucial role into the community health of the region.
Population health, community health, these are all important to us. We actually take this very seriously, and we're proud and privileged, really, to be partners in the community. So thank you to our medical students for being great ambassadors for us out there in the community, for sure. Very good. All right, now an area clinically that you're familiar with, you mentioned your work in the cardiovascular space. Let's take a moment and congratulate our workforce here. Recently, we got not one, but 2 different awards from the American Heart Association. These are what they call the Get With The Guidelines. You're very familiar with these.
Yes.
Not easy to achieve. You have to be high performing in dozens, maybe hundreds of different domains when it comes to care delivery. And there's a couple different awards you can get. The highest you can get is Gold Plus. So it's not just gold, it's Gold Plus. And our group received Gold Plus in 2 areas, heart failure as well as stroke. Really remarkable.
Absolutely.
Comments?
Yeah, absolutely. I think it's extremely, and folks that who knows the work really well, there are, to Dr. McKenna's point, dozens, hundreds of data points and metrics and measures that our clinicians aggregately as a team to be able to provide to our patients, the care to our patients. So for us to achieve both, not one, but 2, it's an achievement.
Very proud, and we know the care we deliver here is excellent from our own outcome measures. This is a validation by the American Heart Association that we deliver the best possible care. So congratulations to the entire team who did that. Yes. Speaking of great, let's talk about 2 recent award winners. We'll start with our DAISY Award winner. We talk about these every month, and these are individuals who have been recognized. These are nurses who've been recognized not by their peers, but in a very special way, they've been recognized by patients that they have cared for, who took the time to write them up. And I'm going to give you the honor of reading about this recipient. This is Brady Nichols. He's an RN who works on C7 Pediatrics. And if you would do us the favor, can you read what they said about Brady?
Absolutely. And I want to read this word by word, so do it justice from the family. Right, so Brady was nominated by our parents of the patient in pediatrics who spent several days in the hospital. They wrote, he cared for her, that's the patient, during 3 night shifts. Not only was he competent with his duty, but he was also cheerful and willing to go above and beyond. For instance, the simple luxury of offering to bring me a cup of tea, and that's the family, in the morning, or going out of his way to fashion a shoebox, quote, nest, unquote, when my daughter came back with a magical, quote, egg, which was a rock, and from the healing garden. Brady is a holistic healer who attends not just to the body, but to the whole being. And I think I will add a comment to, it's not just the patient, but the family that we're caring for as well in the community. And Brady just expressed and I think represent the nursing in spirit on that. And I want to pick up one word about that this parent wrote here, luxury. And I think this is something that seems, it could be simple, but it really have impactful and it's to patients' lives and or families. And in challenging times and in healthcare, and I think I want to really shout out to Brady that this is a luxury that we can still offer to our patient in a challenging time, and that's not an easy feat. Well said,
well said. And congratulations to Brady, well done. And the cinnamon rolls,
yeah,
they're on their way. They're on their way.
They had it.
And
yes.
Now I'd like to talk about our Eye Care Award winner. We had the opportunity, the privilege of recognizing this person at this week's CCLM. And this is Sky McKinney. And Skye works in the practice as a registered nurse in neurology. And obviously, I just want to point out that Skye's been here since 2015, started as an ASA, became an LPN in our Grow Our Own program, which Albany Med recognizes and gives an opportunity and subsidizes professional development into the nursing practice. Skye took advantage of that and hit all the targets we want in our eye care winners. Skye is full of kindness, a colleague said, respect, has a beautiful smile for everyone. She's a wonderful ambassador for care, a warm and caring personality that shines through every day. Patients adore her, and we are grateful to have her on the team. So I think she she spoke at our CCLM, and she did a wonderful job, and so we congratulate Skye as well. Let's second last item. We talked briefly about COVID. We've not spoken about COVID here in quite some time. We were reminding ourselves that when these videos first started, that's really all we talked about back in 2020 and 2021. Thankfully, we haven't had to talk about it in a while. I think that's still the case. It's been in the news. There's been some talk about case counts going up. For those who watch these videos and are looking for an update, what I can tell you is that the numbers, as represented by people in the hospital or employees who are testing positive, are still very much on an area that is not concerning as far as our ability to care for patients. It's not going to require any change in our practices. We're not requiring anybody to go back to masks at this time. As far as I'm concerned, the hospital looks and runs like it did before COVID. And as I've said many times, including going back as far as 2020, COVID is a virus that will be with us here forever. Most people who get it these days, thankfully, develop symptoms that are very similar to a cold. Some might get sicker, and we'll take care of those if we have to. But reassuring to our workforce and to the community right now, things are absolutely nothing to be concerned about at all.
Great.
All right?
Yes.
And then the last thing I'd like to say is, as we're going into the weekend, it is actually a holiday weekend. It's Labor Day weekend. We talk about this quite a bit. We run 24 hours, 7 days a week. It's something I talk about to our new employees at New Employee Orientation. Makes our workforce different. You come in the hospital at Saturday night at midnight, we're here to take care of you. And we have an entire workforce that does that. And that includes not only working nights or working weekends, it also means working holidays. And so for those of you who it's your turn to work this holiday weekend, we appreciate you now more than ever. And just know that our community also appreciates you being there, taking care of them whenever you need their services. So that's what makes healthcare so different, right?
Yes, I echo that. Your heartfelt thank you for our staff, our leaders who are working through this holiday weekend and provide the care that our patient needs.
And I know you're part of a rotation that Dr. Page leads, where members of his leadership team come in on the weekend, every weekend, checking in on our workforce. And I know I've certainly been in here myself, checking in from time to time. And we'll look forward. We'll make sure we check on you this weekend as well. All right, Kevin, thank you for joining us.
Thank you, Dr.
Welcome to Albany Med today in the videos, and we certainly look forward to having you back again.
Thank you for having me.
All right, very good. We ask that you once again please take care of yourself, take care of each other, and we'll see you soon.